This is Tracy MacNeal from Ximedica, and I'm here with Venk Varadan from Nanowear. And we're doing a webinar today called The Connected Self. It's a topic that is exciting for a lot of people, the past, the present, and future of digital health. It's an exciting time in the industry, and we have some cool thoughts to share with you. So a couple of moments about ourselves. My name is Tracy MacNeal. I'm the president of XimedicaDx, our diagnostics business unit. I've been working in the pharma and med device space for about 20 years. I'm an engineer by training, moved over to the business side, and the bottom line is I love technology, I love business, and I'm excited to be here today. Venk?
Yeah, hi, everyone. Thanks for having me, Tracy. My name is Venk Varadan, co-founder and CEO of Nanowear. We're a connected self-technology and analytics platform for diagnostics and disease management built on first-of-its-kind cloth-based nanosensor technology. I'm also a wonk like Tracy, engineering and biochem by training, and moved to the business side shortly after college, and started Nanowear about 3 years ago, and really excited to be part of this evolution of the connected self that we really think can transform healthcare.
Absolutely. What Nanowear has been doing is really exciting, and Ximedica is working on a lot of really great projects too. So I just wanted to take some time to divide up some of the trends for the audience into past, present, and future. So we're talking about Gen 1 of wearables is the group of devices that started about 2010. So we were all there for it. It had some really great pros and cons, but it had some cons as well. We want to talk a little bit about those. Primarily, it was consumer driven, right? Which is pretty different from where we're heading in the medical realm. But Venk, you want to talk a little bit about your reflections on Gen 1?
Sure. And as you mentioned, Tracy, I think all of us as consumers were sort of inundated with the Gen 1 and really allowed us to dream about the potential of what wearables can do, not only as consumers, but as medical applications as well. And that's the idea of capturing data off the body and making sort of interpretive recommendations to change our behavior, change our treatment, all at the comfort of our home, ideally. And as you mentioned, the consumer is where this really started. There were a lot of hundreds of different wristbands capturing sleep quality and or heart rate, what have you. Even on the medical side, when you think of companies like iRhythm and Infobionic, there were hurdles on both the medical and consumer ends that they had to address, and that Gen 2 companies are really mandated to address for us to continue this evolution. I think usability is certainly one thing. Not everybody wears something on their wrist every day, and from a consumer standpoint, it wasn't as much of a need to have. So people would get this for a Christmas present, and by February, it would be in the drawer. Many of them were fitness oriented, even the garment companies, all of them really didn't solve battery life. They were using Bluetooth Low Energy to push these complex packets of data. And the more packets you push, the more the battery life was sort of draining, and it wouldn't last for more than 2-3 hours. Those sort of culminated in consumer fatigue and compliance. And that's very important, even particularly on the medical side, because if the patient isn't using the device as needed, we're not getting the data that we could do interpretive analytics anyway. So it almost makes the device useless to us. But I think most importantly on the Gen 1 side, signal fidelity was really the big deal of all of them. We sort of blew by the idea of capturing very clean data. With your Fitbit, you're just sitting on the couch with a heart rate of 120, and you haven't been running or anything, you've been lazy. But on a healthcare side, if we're getting sort of bad pipes feeding noisy data, best case, we've got false positives that don't necessarily affect the patient but may affect diagnosis. Worst case, we're misdiagnosing patients. We're giving them extra blood thinners when they shouldn't have it, or they're actually showing up to the emergency room because we missed an alert because the data is noisy. So signal fidelity is something that, coupled with everything else, usability, compliance, battery, really needs to be addressed in Gen 2 going forward.
Right. If it's going to be a medical device, it's got to be durable.
Yeah.
So now we're now we're in this new chapter. We're calling it Gen 2, and the space is really evolving. There's some huge issues that we've made dramatic progress on. So usability, human-centric design, all of those. So usability and human-centric design really improve patient adherence, right? To your point, Venk, if it's easy to wear, I'm going to wear it. If it doesn't go with this outfit, I'm probably not, right? But beyond that, there's also really important issues of cost that need to be addressed for it to be an effective medical device. Something that the patient doesn't always see, but some of the regulatory and legal constraints that are happening are really changing the life for the provider. So the workflow in the hospitals and clinics needs to be included in our approach. And finally, compliance and regulatory, to your point, it's got to be robust. So what does that look like? What have those market trends looked like for you at Nanowear?
Yeah, and I think we have benefited fortuitously on being able to sort of look at some of these trends and adoption in the past from our friends that sort of were trailblazers in this space. We really addressed the usability and patient adherence a few minutes ago, but cost, I think, is something that we have learned a lot. And this idea that the consumer is going to pay for everything, I think we sort of clearly understand that there's a small niche market for that. In tech, we typically sometimes make technology for the people around us and not the people that are really the masses that need the solution. When we think of the American population alone, close to 40–45% are Medicare and Medicaid patients. They're just not paying out of pocket. I mean, we can give the best advice imaginable that would keep them healthy, and in between 3 jobs and raising their kids and putting food on the table, they're not going to spend $300 for a wristband or a patch.
That's right.
We're just seeing that. So that feeds into the provider need on, they are hemorrhaging at the sort of hip in the sense that they can't have these patients show up to the emergency room every day. And so we have to monitor them at home, but who's going to pay for that device? Hospitals are a little bit hesitant in paying for this value-based idea that we're going to make up money in the future if we do show those trends. So it's got to be a low-cost solution that Medicaid can pay for, and Medicaid and Medicare can see the outcomes of this cost because they are the ones that are paying for these patients showing up to the emergency room. We're never going to be at a place, and I hope we never do, where we're closing off the ER to our patients. So I think that's what we're trying to address at Nanowear. And our first product is in congestive heart failure. A case study is a Medicare grandmother of 3 still working. She was hospitalized 7 times last year, and that's affecting costs for the provider. It's affecting costs for CMS, and most importantly, it's really, really hampering her quality of life. What if we could manage her with a monitoring, non-invasive device? It's easy for her to use at home, easy as putting on her sweater, and alert the hospital of decompensating heart failure weeks in advance of when she shows up to the emergency room. That can save and reduce a $40 billion annual cost to our healthcare system that's affecting 7 million Americans every year. So that's an example of where I think Gen 2 wearables can go. It's got to start with our sickest of sick, high-risk patients that really have issues with all of the areas that we were talking about. And then I think we can filter into the consumer and other applications, which I know we're going to be getting to in a second.
Yeah, it is not a small thing to make that level of robust medical device a washable sweater. That's absolutely incredible. So, okay, so where are we going from here? There's so much to talk about. We have so little time, but I love something that you say, Venk. I want to replace every sensor on the planet with a blanket. I love this picture of the baby. Imagine having, and Nanowear has done this, right? This is where the connected self is going. What would it be like to have the connected self be so nourishing and easy? Yeah, what do you see as possible?
I just think that's where this has to go. It has to be something that we don't actually change anything in our daily life. And that's why this idea of the blanket and clothing, it's something we do every day as humans, as a human species. We lie down in our beds and we put clothes on in the morning. If we can just simply capture medical grade data ubiquitously through these basic daily actions and not ask the patient to be doing something that they don't normally do, that's where I think that this can all go and where it all should go. Sensorizing the bed sheet or the baby's crib, all the way from infant monitoring up to our elderly and our sickest of sick. That's where I think that the connected self is really going to transform this idea of finding things early and modifying either behaviors or treatments or triage.
Right. And making it so, having it be a human-centric design that way is core to Ximedica as well. And thinking about what would be possible by making it so easy. You can have it on the battlefield. You can have it with our public servants, the EMTs, the firefighters, police officers. One of the things that I really like thinking about also is making this data actionable, right? So if I'm wearing my my wearable watch and it tells me I didn't sleep well. First of all, I don't like sleeping in a watch, but if I do, and it tells me I didn't sleep well last night, there's not really a whole lot I can do with that information except be kind of sad about it. But we talk about like kind of a heads up display, you know, before we have that fourth glass of wine, if I can really see what's going on with my pancreas right now, before I make the bad decision, right? And I think you've made some great points about the variability from patient to patient and what medical grade data can do in terms of good decision making before the outcome, right? To really influence the outcome itself.
I think the consumer is where this is all going to end. Your point about the sleep quality, if we can prove this in our sickest of sick patients and protect our men and women on the battlefield and our first responders and industrial B2B applications, the consumer is going to have confidence in that data and the analytics. And it goes back to signal capture. If we're capturing the right and clean data, you're going to know, Tracy, how that fourth glass affected you, and I will know how the fourth glass affected me. Or if we ate, you know, a steak versus, you know, lentils an hour before we went to bed, what the difference could be on that sleep quality. And that's just in an application for sleep. Think about everything else that the consumer is going to want to know. We don't need more data and more tech. We need the right data and the right tech to make these actionable insights to change behavior and eventually treatment in the medical field.
Wow. I think it's such an exciting time. I really appreciate you making time today, Venk. It was such a pleasure. And I wish everybody in the audience the best in your adventures in digital health. And we look forward to seeing you in the next webinar. Thank you.
Thanks for having me, Tracy. Thank you, everyone.
All right. Bye.